Good morning, good afternoon, good evening, wherever you're joining us from today, and welcome to this edition of the City Health Talks. My name is Joe Jewell, and I'm the Director of Cities for Better Health. Today I'll be guiding us through an interactive and exciting hour of discussion as we explore a critical and timely question around what does it take to create healthier environments for children, and what roles can city play in that journey. Today we're facing around the world, in cities, at the country level, issues such as childhood overweight and obesity. And we see that they're on the rise across the globe, whether that's in high-income countries, middle-income countries, or even low-income countries. And we see these issues affecting particularly underserved communities and underserved urban areas, where we find that the barriers to health are most pronounced. This is a problem not only for the children today and of tomorrow who experience the physical and mental consequences of ill health, but also for the future generations, because we know that childhood overweight and obesity and childhood ill health often traces into adulthood and can increase the risk of serious chronic diseases like type 2 diabetes, cardiovascular diseases, and cancer. So we really have a task ahead of us to invest in healthy future and healthy future generations, and we must ensure that all children have access to nutritious food, safe spaces to be physically active, and the opportunity to grow up healthy and have a good sense of well-being. We know from the evidence and practice around the world that this takes a variety and many different combinations of interventions at different levels of societies. But we also believe that cities are very well placed to drive some of this change. We know that bold local action, cross-sector collaboration, and innovative partnerships can really help transform environments for children so that all children grow up in spaces and environments and places where they can be healthy. Today we want to dig further into this and explore why this work is so critical, what is the evidence base behind it, what is the case for action, and also to share some real-world examples of how cities, communities, and governments are taking action. As always, we want this to be interactive. I'm going to be stimulating a good discussion with the participants and the speakers who are joining me today, but we also want to know and hear from you. So where are you joining us from today? What experience do you have with this topic? And are there any burning questions that you have at the forefront of your mind that you want answered? You'll find the option to raise questions in the chat, so please just fire those away. I have a team here helping me who will direct those questions towards me, and we can make sure that your questions are answered. So let's get started. Today we have a really interesting panel of speakers who are joining us from different parts of the world and different expertise. But really what unites them is that they are leaders who are driving change for children, for health, and often thinking about what can be done at different levels of government. Each speaker has a different and unique perspective, and so we're really excited to give them the space to share their views and then bring them together for a panel discussion at the end. Our first speaker today will be Ravi Gurumurthy, who is the Group Chief Executive Officer at Nesta, which is the UK Innovation Agency for Social Good. He's working with Nesta to reinvent public systems through innovation, designing and scaling solutions to tackle complex societal challenges such as obesity. Joining us from Brazil, we're welcoming Milena Marques, who is a physician at the Municipal Health Secretariat in Campinas in Brazil. And she will share how Campinas is working across departments to improve food systems, redesign public spaces, and support children's health through the Cities for Better Health Childhood Obesity Prevention Initiative, which is locally known as Passos för en Vida Saudável, Melhor Vida. That was my attempt at speaking Portuguese. And last but not least, we are joined by Nikita Sinclair, who is head of the Children's Health and Food Programme at Impact on Urban Health, which is based out of the UK. And Nikita will share insights from their approach to shaping children's food environments for health benefits with local partners. So thank you all for being here with me today. And to kick us off, I'll hand over to Ravi, who will unpack the opportunity of changing environments to enable healthier lives for current and future generations. Ravi, the floor is yours.
Thank you very much, Joe, and great to be with you and with such a great panel too. As Joe said, I'm the CEO of Nesta. We're an innovation agency. We try and design solutions to big societal problems. And one of our missions is obesity and how we can halve obesity. And that sounds like a ridiculously moonshot goal that seems unachievable, but I want to try and persuade you that it is actually more achievable than we might think. So if you show the next slide, I think what it shows is that if you wanted to reduce obesity by a half in the UK, which sounds extraordinary, and return it back to the level it was last seen in 1990s, you actually have to reduce the calories taken in by all people, by adults with excess weight, by about 216 calories per day. Which, to put that into perspective, is about 8.5% of a typical person's intake. It's a small bottle of Coke. So it is a manageable level. Obviously, that's lower if you're talking about childhood obesity. So first of all, it is a manageable amount. The key here is it has to be a permanent, sustained reduction rather than a faddish diet. If I want to reduce my weight by 6 kg as a 79 kg man, I could do it through a calorie deficit of 1,200 calories for a month, 600 calories for 3 months, or I could do it with 200 calorie deficit over about 2 years. And that's the sort of slow approach to tackling this problem. So on to the next slide. If that is our goal, to try and reduce obesity by about 200 calories a day, and therefore get you to that reduction and a half, how do we do it? The obvious thought is, well, people should diet, people should make conscious choices themselves. Maybe they should exercise. But I think we know that when it comes to exercise, for instance, that doesn't tend to work. Most people don't do it, or they don't do it sustainably. And often they tend to sort of eat more as a result of doing their exercise rather than stay the same. So exercise doesn't tend to work, and willpower gets quite exhausted, and we find that only the very health conscious manage to be able to stick at it. So what we think is that the way to get to this 200 calorie reduction is through changing the food environment, changing what is stocked in stores, changing the price, changing the portion sizes, changing the advertising regimes, so that you are bombarded with all the healthy choices, and doing the healthy choice is the easiest thing to do. It's almost the default, rather than having to wade through all the negative signals that we currently get from our food environment. So we're looking at a variety of different ways at Nest to change the food environment. And I should say that this is for adults as well as children. And it's our view that if you do want to tackle childhood obesity, it's not just through targeted children's policies, children's school meals. You actually have to change the whole food environment that children and adults live in. So if you go on to the next slide, we've got one policy that I wanted to flag up to you that I think is particularly interesting in terms of the degree of impact it could have. And that is something called mandatory targets for supermarkets. And just to give you a bit of context in the UK, if you move on to the next slide, we have 11 major supermarkets in the UK, and they are responsible for 95% of all of the food sold by retailers. And if you include even the takeaways and restaurant meals, they make up about 80% of all the calories consumed in the UK. So they're a huge point of leverage. And we have a proposal which is to increase the healthiness of what is sold in those supermarkets through regulation. Now, at the moment, if you rank all the supermarkets in terms of the healthiness of what they sell, you can see this graph is based on what's called the nutrient profile model in the UK. So it's a measure of the healthiness of what they sell. The average is about 67. 100 being good, 67 is the average. If we could get everybody up to level 69, which is just above where the top performer, store A, is, that one shift, that could reduce obesity by about 20% in the UK. And to, again, give you a sense of scale, all we're saying is that if supermarkets reduce the calories they sell every day by about 4%, less than 4%, that will equate to this huge reduction in obesity of about 20%. So that's an example, I think, of a universal policy that will have huge effect on everybody. And for children in particular, we think this policy would reduce the number of obese children by about 340,000 children. So that's the scale of the impact. I just want to end with one point. If you go to the next slide, we have tried in our work to try and bring a lot of evidence to the conversation. And what we did, this is one policy, that mandatory retailer targets, that we've reviewed. We reviewed 30 others that we thought were promising. And we looked at 4 things: the cost of those policies, the benefit, the quality of the evidence, and the degree of financial saving to society. And that's all laid out on the website if you want to look at it. And we've tried to look at 3,000 papers to review the evidence and make sure that we have a conversation about obesity that involves numbers, not just words, because I think quite a lot of policy in this space is directionally right. It's along the right lines, but the dosage is not big enough for the scale of the problem. So happy to hand back now to Joe and cover any questions.
Thank you very much, Ravi. That was a really interesting overview of also the work that you're championing in the UK at Nesta, and I think it's also an agenda that probably takes place across different countries as well, seeing like what are the settings in which our food environments are shaped, like retail, but also school food, the marketing environment, etc., and thinking about how we could improve those, tweak those, and make a substantial impact on people's diets and also their risk of developing health conditions. So, I mean, I think thanks so much for pulling out that example of the food retail environment. And of course, that's something that we need to think about at all different levels of our work. So, you know, how do we influence the national food policy environment to encourage, you know, the retail environment to be healthier? But also, I think in some of the initiatives that we're speaking to later in the webinar, maybe there's also a think about, you know, what actions can be taken in the retail environments locally. So it's always, I guess, a combination of actions, thinking about how the national level or international level, in some cases, can set the right regulatory environment, and then we can dial that up through tailored interventions locally. I just wondered if you would one of the most important considerations for us, and I think we'll be continuing this theme during the conversation, is around how to work with and develop solutions that are going to respond to the needs of underserved communities. And I'm just thinking about the work that Nesta drives nationally, and thinking, what is the equity angle in the work that you do at Nesta, and how does you know, the work on on health and obesity actually feed into the agenda on equity, which I think is also part of your other core goals, including fairer start, etc., at Nesta. So yeah, maybe a few words on that, Ravi.
Yeah, well, as you know, there is a social gradient. People from poorer backgrounds are more affected by obesity in the UK than the average. So what we're trying to do is not just reduce obesity overall, but do it particularly for the most disadvantaged communities. I think what we tend to think about is how you can make some of the universal policies that we have more progressive. So let me give you an example actually from the mandatory targets that I just mentioned for retailers. First of all, given that some of the supermarkets that serve the more deprived areas are lower down that league table, if we set an absolute standard, we expect those supermarkets to have to make more action in certain places than others. So it might be naturally a progressive policy that levels inequality. However, there is obviously a risk of supermarkets behaving in ways that are regressive. They might choose to get more of their calorie reduction from a richer part of London than a poorer part. So one way of addressing that is actually having an equity consideration factored into the policy, measure the location of what is sold by deprivation, and either have a target to narrow that gap or at least maintain it, or perhaps the power to step in if we see equity considerations getting worse rather than improving. So that's how we think about it in our work.
Great. And in that package of other policies that you recommended, perhaps you could also give a little bit of a pitch for some of the other policies that are at the forefront of your mind. So let's say we solve the food retail environment through a really effective policy and regulation. What else would you love to see action on to shift the needle in the UK, but I guess in other countries?
So I think two things I'd highlight. One is the whole advertising environment. So from first principles, you almost want to experience things online, in person, on your train journey in, so that you're not bombarded with advertising junk food. And what we can't do is almost play a whack-a-mole strategy where you squeeze it out of one area and then it pops up elsewhere. You have to take a sort of more holistic picture and reward those brands that are prepared to be healthier, and try and avoid that sort of deluge that we get now. So that's the first policy instrument that we think would have a huge effect both in shaping consumer preferences, but also incentivizing companies to reformulate so that they can be healthy and therefore advertise. The second thing is really the out-of-home sector, which I think is much, much tougher. So we've seen with the out-of-home sector many, many meals that are way beyond the even the daily calorie allowance that you should take in. So one meal is more than you should take in for a whole day. And I think we've got a big issue with portion sizes and the out-of-home sector. It is harder to regulate the out-of-home sector. It's a much more challenging thing, but I think there are ways that we could do it. For instance, some of the delivery companies like Deliveroo, they obviously have power over and can shape the food environment to some degree. So could you adopt a similar approach that we have suggested with retailers for something like them? But obviously, I think the other way of doing this is through sugar and salt taxes. That is difficult during concerns about inflation and the cost of living, which is why we think that the regulatory route, advertising standards for retailers, standards for the out-of-home, is probably more politically feasible, but could be just as effective.
Yeah, interesting. And so, I mean, when you were talking about the out-of-home piece there, I was also imagining like how this translates into a healthier high street in a sense. Like, you know, you've got the retail piece, working with the supermarkets and retailers to improve their offer, make sure that's healthier. There's also something about the convenience food or fast food venues that we see on the high street, whether that's a chain or an independent one, that also needs to be improved. And then also removing some of the advertising that children will see either physically along the streets or on their mobile devices or on television, I guess. So sounds like you're advocating for sort of like a very joined up set of policies to create a healthier environment for the population and by default children.
That's absolutely right. And we take our cues from what other people do on the high street, what shops we see, what people are eating. So when people say, well, we should just inform and educate people, they're forgetting that they're being informed and educated in all the wrong ways through all the other cues they see socially. So I totally agree. You've got to take a fairly joined up picture on this. Just one thing I'd plug as well, which is the role of technology potentially in helping us. So we've actually got a venture called Melia, where if you provide the budget that you want to spend that week, some of your health preferences, it will then give you the recipes that you can cook, and you can just say yes, and that will automatically take you through to some of the big supermarket chains like Tesco and Asda and buy your weekly food shop. And I think that allows us to be a little bit more in control, both of our budget and our health. So that agentic shopping experience, I think, will start to happen more and more in our lives, and that could be a way of us exercising a bit more control.
Super. So thank you for now, Ravi. We'll come back to you during the panel discussion. And I think you've really set the stage for some of the topics we're trying to grapple with. And I guess we're moving more now from the national policy level down to the local level and thinking about how cities are actually trying to tackle some of these issues and also create healthier environments at the local level. So our first case takes us to Campinas, Brazil. And I will let Milena introduce the name of the program herself in Portuguese. But we're really pleased that Campinas is participating in the Cities for Better Health Childhood Obesity Prevention Initiative, which is a global initiative that we started recently at Cities for Better Health with the aim of improving the health and well-being of school-aged children from communities around the world. And the way in which it's set up in every city where we're working is that a coalition of local and global partners are working together to design, implement, and evaluate interventions. And Campinas is one of the best examples that we have and is at the forefront of this agenda. And they've been really successful in bringing together a diverse range of local city stakeholders from health to education, sports and social services, who are all united in their ambition for a healthier and happier childhood in Campinas. So before we jump to Milena, I think we will see a short video from Campinas to set the stage, and then we'll have a presentation from Milena. Let's look at the video.
In Campinas, Brazil, health doesn't start at the clinic. It starts in parks, at the dinner table, and on the walk to school. 1 in 6 children in the city lives with obesity, and Campinas is taking action. Passos para uma vida melhor, or Steps to a Better Life, is building healthier futures by strengthening the systems that shape daily life. Part of the Global Childhood Obesity Prevention Initiative, From Cities for Better Health, Passos is led by the city and powered by partnerships.
O programa tem objetivo global de promover a prevenção de doenças crônicas nas cidades, então entendendo que esse é um desafio urgente de qualquer cidade no mundo. A gente está falando de alimentação e atividade física.
É muito importante esse trabalho que vem sendo realizado em relação à prevenção da obesidade infantil e com os adolescentes, ações de combate à obesidade, porque a gente sabe que é uma situação que pode evoluir para doenças crônicas.
Passos brings together schools, health services, social care, and sports to reshape the environments where children live, eat, learn, and play. Public sector staff are trained to work across sectors, designing actions that make the healthy choice the easy choice.
Os ciclos de formação, eles foram momentos importantes para os servidores, proporcionou com que as pessoas se conhecessem e discutissem juntas como tornar aquilo possível e executável, coisa que a gente ainda não tinha tido antes.
O Passos, ele tem a cada dia crescido muito dentro do município, né? Principalmente fortalecendo a intersetorialidade. E a governança do programa hoje potencializa essa relação entre as várias secretarias, entre as várias áreas que fazem parte do programa.
E o objetivo é esse, né? Fazer ações intersetoriais, intergeracionais, que favoreçam a inclusão e esses processos de trabalhos coletivos dentro do nosso território.
So far, the program has trained hundreds of local professionals, led over 110 actions in all neighborhoods in Campinas, and reached more than 14,500 people. In 2025, Passos is expanding citywide, so that every child in Campinas can be healthier and ready for the future. Because when a city comes together, real change doesn't stop. It takes root and grows.
Great to see the action taking shape and coming to life on the ground. Let's learn a bit more about how this program is working and cross-departmental approach, how it's come to life in Campinas. So Milena, it's over to you for your presentation. Thank you.
Thank you very much. It is an honor to be here and to tell a little bit about how our city did all of this. Actually, I want to point out the last words of the video when it said that when a city comes together, real changes doesn't stop. It takes root and grow. And the reason why I want to point out those words is because that really reflects what the program Passos is all about. The program was launched under Cities for Better Health. In a city which is very big, our city has a population of over 1,100,000 people. So our challenge is very big as well. And after the pandemic, we noticed a rise on chronic diseases and unfortunately on obesity and childhood obesity. So when Cities for Better Health arrived, they could not have come in a better time. And the reason why that was so special and so important for us was because Cities for Better Health allowed us to tackle this issue in a very different way. Next slide, please. In a way that we have not been used to, which was in a cross-departmental collaboration. And I want to start by saying that this is the key that made the program Passos such a success. And this is also the key that is bringing now Cities for Better Health now with COPI, the Childhood Obesity Prevention Initiative here in our city, the foundation to build upon. So cross-departmental collaboration was something unique that we did and that really brought the success to the program. So how can we structure all of this in such a big city? We decided to do 3 levels of working group. We had the center working group, which I am in that group, which is a strategic decision group where we talk about everything and we make the decisions. And then we had the regional working group that further implemented all the decisions to the local working group, the group that would execute the initiatives on the ground. And that was the framework that the structure of this Passos program was built upon, and that really helped the program to achieve its goal. Next slide, please. One of the things that I talk about when I said city comes together, it was because when Cities for Better Health arrived, we actually had the chance to have what? The health department, the education department, the sports and leisure department, the cultures and tourism department, the development and social care department, also SEASA, which is a supply center here in our city that provides nutritious food for our public school, and as well PEAK. PEAK is a early childhood program that we already have here in our city, Campinas. All of these departments working together, talking, discussing, that made a huge breakthrough in health promotion. So the intersectoral approach on this program was the key success of it all. And how do we do that? After coming together, we decided that we wanted, firstly, to take care of our own public employees. So we motivated them, we taught them, we showed them how it was important to have healthy choices, healthy food, physical activity, how that would benefit for their longevity. So after we got our own taken care of, we trained them. And then after the training, they got together and then they co-created the actions to be doing on their community, on their territory. So that really enhanced our time, it enhanced our resources, and also enhanced the impact that we have in the city. Next slide. And the program expanded. As you saw in the video, yes, we had more than 100 actions on the field and more than 14,000 people impacted. And that's because it is numbers from impacting of half of the city. We started out with 5 neighborhoods, and that was very, very precious because on those 5, we were very intimate there to see what was the key challenges, what we could enhance better, what could we do better. And after those 5, such a success was risen. And then later on, we decided to go to cycle 2, which was half of the city. And then we trained them, did everything. It was amazing. And on this year, we decided that the initiative would have all of the city. And because of that, we did an online course. And they are right now finishing their online course on the training. So we're very looking forward for what is going to happen with all the actions that are coming up on the local territory and inside the communities. Also this year, COPI arrived. And now we can have a more enhanced local view on our children because it really is. The childhood obesity has been something that we need to tackle. And with the program passes being such a legacy in the city, we know that COPI will make it even better. We have actions such as a school would open up on a weekend. So it would be a safer place for the children to play. They would have people from the sports and leisure there to exercise, to treat them for physical activities, but not only for the children, also for the parents and their relatives. There'll be people from the healthcare teaching about all the things that they need to be healthier. There will be people from SEASA bringing healthy food for the education team. Imagine a whole day with the family being packed with great education and seeing what really life can look like, a better future. So we do also have our limited resources as human resources, but our engagement on this project has been amazing. And we're very looking forward because we really want to help our children to thrive in life. And we know that early habits do shape future. So we're very excited for what the future holds.
Thank you so much, Milena. Really lovely overview of all the work, and congratulations for all the achievements so far. I think I had the privilege to visit Campinas and see it firsthand. And I also think what's beautiful there is all these different departments coming together, thinking about what's their competence, mandate, resources, and how those could be put towards better health. The schoolyards that you spoke about, it was amazing to have people with responsibility for the fresh food markets engaged, etc. So I really have high hopes for what we can achieve together in Campinas. And of course, with the Childhood Obesity Prevention Initiative, what we're also doing this time round is dialing up the monitoring and evaluation to also see if we can come out with some strong proof points also to the benefits for children's health and well-being. So watch this space, and thanks a lot, Milena. We'll come back to you for the discussion and panel discussion. So now it's also a chance to move to our final speaker, who is Nikita Sinclair. And she works in an organization I've long been very impressed by because of their place-based action and commitment to working with communities in a really impressive way. So yeah, just to repeat, Nikita works for Impact on Urban Health, which is based in London and works very closely with communities in South London to address some of the health inequalities and the environmental and social challenges that make it difficult to achieve health together with communities. They partner with diverse stakeholders and have a priority around reshaping food environments across homes, schools, and streets. And I think their work is really testament to what is possible when communities are at the center of this change at the local level. So Nikita, the floor is yours, and keen to hear an update on the amazing work that you're doing with community partners.
Thanks, Joe, and hi, everyone. Good to be here today. My first slide, great. So yeah, obviously Joe's given us a bit of an introduction as to who we are at Impact on Urban Health, but if you don't know us, we are the philanthropic arm of Guy's and St Thomas's Foundation, which is one of the largest health foundations in the UK. And our work in particular focuses on how can you build health equity in urban areas, focusing primarily on our home boroughs of Lambeth and Southwark in South London, but really trying to share what we learn, what works with other cities around the world. So it's really great to be able to share some of our work with you guys today. And I think key to our approach is really the understanding that poor health, poverty, and racism are so deeply connected. And so what we really need to be focusing on is how we break these links. And practically what that means for us is focusing in on some urban health challenges that we see really prevalent in cities in our 4 key programs, one of which is Children's Health and Food, which is the program that I lead on, and I'll tell you a bit more about today. So on the next slide, our Children's Health and Food Programme strategy really echoes one of Rabi's slides, actually, which said what surrounds us shapes us. And we know that this is so critical when it comes to children's health and food. So all our work focuses on how do we shift the food that's most available and affordable in the places where children spend their time, which is why we have 3 strands of our programme that focus on streets, schools, and early years as the kind of key places where we feel we have the most levers available to shift what's available to children and families. And we focus both on how do we restrict the kind of flow and bombardment of unhealthy cheap food that's currently happening in these places, and how do we also increase the flow of the good stuff to the healthy, affordable, culturally appropriate food that we know that children need to live a good life. I also want to flag just 3 key ways in terms of the how that we approach our work. So firstly, we centre equity in everything that we do, whether that's at a programme strategy level, at a particular partnership level, thinking about how we centre the lived experience and expertise of those most affected. And for children's health and food, we focus in particularly on income as the largest driver of inequity, but we are also interested in how that intersects with race. And I think that that's quite commonly seen, how poverty and race intersect in urban areas. So we're learning more and more about that as we progress our work. Secondly, we're all about collaboration. So we work through partnership with others across sectors and also at different levels. So recognizing that we need to shift things at national, international, regional, local levels to create change on the food system. And finally, we are really trying to build a new narrative about this area of work that really shows that what surrounds us shapes us rather than individual choices. And we feel that that's a real crucial factor in creating the conditions for change on this issue. But today, what I want to focus in on is a really tangible example of the kind of work that we think cities can be leading on. So on the next slide, you'll see the partnership that I kind of want to speak to you all today about. But before I get into the work of Alexander Rowe's charity, I just wanted to reiterate what Joe's been saying today, which is that cities have a really crucial role to play. We definitely believe that national policy is a huge driver for change in the food system because of the prevalence of big food corporates in shaping what's available locally. But when it comes to ensuring equitable outcomes, as well as the things that Ravi was talking about in terms of policy design, it's really crucial that cities and local areas are taking action focused on those that are most in need to make sure that we're having that equitable impact. And our work with Alexandra Rose since 2018, I think, is a great example of that. So Alexandra Rose charity have been working in Southwark for now the past 7 years to provide fruit and veg vouchers to families with infants who are living on low incomes. And those fruit and veg vouchers can be used at local markets or food cooperatives. So really kind of locally embedded in the food economy where these vouchers can be redeemed. And their work is also a really strong example of cross-sector collaboration, because they are a national charity that have a really proven model of the fruit and veg vouchers, but they work in partnership with local organisations that are known to be able to connect in with local families in need, so children's centres, community organisations. And then they also collaborate with local independent businesses, so the market traders, the food cooperatives, and all of that has been supported by engagement with the local city council, who have played a really critical role in enabling this work as well. And the one other thing that I want to highlight about this approach, as you'll see on the slide, is that it's been really crucial when we think about equity. So because of the community embedded nature of the work that they do, they're really successfully able to support those that are most structurally disadvantaged in our communities. And in addition to that, they are really supporting the financial well-being and the viability of the market traders, who are often coming from these communities themselves as well. So there's kind of two angles to the equitable benefits that we see from this approach. But if you move on to the next slide, as you all want to know, what have we seen about how this is affecting local families? Well, we did an evaluation last year which showed that there's a really huge increase in child and parent nutrition from the access to these vouchers. So both children and parents are eating more of their fibre a day. It also has improved the variation in diet, because there's the reduced risk of kind of buying food and fruit and veg that children won't want to eat. So it means that parents are trying new things with their children. It's particularly been really crucial in enabling racialized parents and families to access culturally relevant fruit and veg that is often not very affordable at these markets, or even not available in supermarkets. And all of this, these kind of health benefits have also kind of spanned into other areas. So it's quite clearly having a financial impact on family finances, which is also alleviating stress for parents. And it's also enabling them to connect into other aspects of community support. So quite a holistic approach that is being taken, even by just focusing on food. And if you go on to the next slide, I guess I just want to make a final point, which is that often when we design and focus on action that can improve children's health, there's other benefits that are really important for local areas and cities, and one of which is how this affects the local food economy and the economy in general. So we've seen through an economic impact assessment that Alexandra Rose commissioned that this approach is actually putting money into the local economy beyond the cost of the initial vouchers, and that's through the kind of traffic that it drives to the market and the kind of multiplier effect that it brings. And I know if other cities are at all in a similar situation to the UK, our local councils are really struggling at the moment financially, and you know, thinking about how any interventions can bring multiple benefits and an economic benefit is something that's really front and center of mind. So I think thinking about children's health and thinking about the other benefits that those actions can bring may be something that's really motivating to get cross-sector actors on board with the type of change that you want to see. But that's all from me, and look forward to the panel discussion.
Thank you so much, Nikita, for a really inspiring but also very tangible presentation about what can happen at the local level, and for being an advocate for what also cities can do to make an impact with their communities. So, I mean, a few things I took away from your presentation was, the key domains of action: streets, schools, early years. I loved that you pulled out the national and local dimensions to it. So, supporting some of the messages that Ravi made, but also calling out that there is a need to respond and develop initiatives tailored to the local community. You spoke about centering on lived experience and equity, and then also being smart about capturing the return on investment and the wider societal benefits of programs like this that address health inequities. One question that I may just target to you before we open to the rest of the panel is, it was a really interesting example of how you can also engage with the local private sector, whether that's small vendors, market stalls, retailers, etc. So what was your experience, or do you know from the Alexandra Rose charity what their experience was of engaging market stall holders around this and getting them engaged? Because I think that could be something that other cities would be super interested to hear about.
Yeah, and we've got relevant learning from another project that we've done with local convenience stores. I'd say one of the really important things is having someone who can physically go and meet these traders or business owners on the ground, be flexible, be tenacious, because often the types of people who are running these kind of small markets or small stores are running on really small margins. They are really responsive to their community, but often aren't going to be responding to different types of engagement that you might send in a typical way from a city authority. So I think being in person and building that relationship is so crucial. I think the other thing is about the expertise that you and your team can bring to those traders. So often for small businesses, any changes to how they're operating, whether it's taking on a new model of income, such as the voucher scheme, or trialing new ways of presenting things in store, comes at a risk to them, and this is their livelihoods, their businesses. And so any additional support that you can bring to them to de-risk those changes so that they can see how those changes in the long term will bring them actual financial benefits is something that has been really effective for our work.
Super, thanks so much. And I'd like to maybe then invite the rest of the panelists up onto the stage, the virtual stage, so that we can have a bit of a conversation. And just a reminder to those of you who are in the audience, please do send in your questions via the chat if you would like to have the panelists answer some of your questions. But I mean, I think, I guess building on what Nikita was just saying here, and moving a little bit into the community and how do you build trust. So Milena, and perhaps others have views on this as well. But Milena, I'll ask you first around, a lot of this work is place-based and it's community-centered. The change that we want to see happens at the community level. So what in your experience is key to building and maintaining trust with the communities that you work with? I'll ask you first, and then perhaps others may want to chip in.
We could see that they built trust exactly when we had the intersectoral approach. The community saw that we had such a vision for them. They saw how much effort we were putting on the local actions, and they were feeling taken care of. That feeling, that human feeling, made them trust. And seeing also the professionals speaking, I'll say, the same language, speaking the same goals, together, doing the same thing, okay, let's have a better life. We want us to thrive in life, and taking care of the kids. That made trust. When we did the actions and they would see the quality of what we were bringing, how we were cautious in everything, and how we wanted to make them feel embraced and taken care of, that really spoke deeply in them. So I believe part of the trust that the community saw was seeing that we were really engaged in changing that.
Thank you. And then, Nikita, maybe if I come to you, and then Ravi, I may ask a different question. But for you, Nikita, you use the word lived experience, and perhaps you want to unpack what lived experience means in this type of work and how lived experience can inform, how we work with communities. But how does integrating lived experience help build trust with communities?
Yeah, so I think in terms of integrating lived experience, I think if you start from a point of trying to understand the lived realities of the people that are most affected by an issue and then build solutions with them from there, you're inevitably like starting from a position where you're prioritizing trust, and also you're going to get to what works much quicker than if you're trying to change things in a way that is devoid of the context of people's lives. So that has always been something that's been central to how we work, and we've definitely iterated over the years in how we're thinking about participation and working with people to center lived experience. But I think the other thing for me that is important to think about when thinking about trust, which we've definitely not got it right all of the time, but I think longevity and consistency is so important for communities, and thinking about that when you're trying to test and pivot what you're doing to understand what works, but committing to creating change for the long term and being consistent in that commitment is key, because lots of underserved communities have seen things come and things go and trust gets broken, and often you might be rebuilding trust even if it hasn't been due to things that you've done yourself. So just some things to think about.
And Ravi, I guess it's very clear that there's a need to think about building trust and integrating lived experience into sort of community level work. But I guess understanding people's lived experience of the food environment is also important to inform regulatory and national policy interventions, right? I think when you were talking about retail considerations, like trying to shift the balance of retail offer, that you also think about the affordability dimension for people who are using those supermarkets. Do you have any reflections on that question, Ravi, as well, about understanding people's experience of the modern food system and how that should inform policy, I guess?
Yeah, one of my favorite projects that we did actually was called Youth Detectives, where we basically enlisted thousands of young people to actually record their online experience of being bombarded with junk food advertising, because it's actually quite hard to almost capture that picture of the online experience as opposed to what it looks like in the physical environment. And I think it's only when you do that you see through other people's eyes. So I think it's very important. The other thing I think is to try and make sure that obviously you're designing for the national average sometimes, but there are highly diverse experiences, and you have to understand what about those people who are living in particularly remote conditions, or who are highly dependent on convenience stores, so it's very heterogeneous. And yeah, you can't make the best the enemy of the good, but we do actually have to make sure we design for everyone. Just one thing I would say on trust, we do a lot of work in collective action generally outside of the health mission, and the co-creation process, how you generate collective action, is a very subtle art. One example I would give you is about how we've tackled bullying in schools, where it's really about finding the most influential children in a school and getting them to co-create an anti-bullying campaign. That is far more effective than choosing authority figures already. And it's really about accepting that trust already has dissipated from authority structures, and therefore you have to co-create with influential peers. Otherwise, you're not really getting anywhere.
Great. And then I have some now targeted questions coming in, which is really exciting. So a question for you, whilst I have you, Ravi, is practically how are supermarkets supposed to reduce the calories they sell? What are the guidelines and recommendations for them to do? And are there certain product categories which are most important to address?
Yeah, so we're actually working with Asda at the moment, one of our major retailers, and doing about 10 different interventions across many stores. And it ranges from everything from reformulating some of their own brand work to putting pressure on what they are on suppliers, their store layout changes every so often, what are their price promotions, what are they stocking, So all of the things that supermarkets do in their daily business, in their business cycles around pricing, promotion, advertising, reformulation, they have to factor health into those, whereas at the moment they're not really optimizing for people's health in that. So that's how I think they can make a difference. I don't think it's about particular products. It's about making almost every single thing in the shopping basket a little bit better. And that's how you eke out almost unnoticeable different changes to the end consumer, rather than sort of a big, we're going to stop people eating a particular thing.
Super. Then a question here is around, I think, people are very excited about the positive stories here and the positive message about what change can happen, but curious about some of the challenges and the barriers and maybe resistance that people may experience when they're trying to get these initiatives off the ground, whether that's a community-based city level or a national initiative. So maybe I address this question to each of you, starting with Nikita, then Milena, and then back to Ravi. So are there any particular challenges you've experienced and how have you overcome them?
I think that one of the challenges about work that you do at a local or city level is getting to scale to have a bigger impact on the communities that are living in your area. And having the time and resources and funding to do that effectively, and the expertise to understand the best routes to scale. And that has often been where we've seen some of our work that started really locally. So, for example, I was talking about the work with convenience stores on our Good Food Retail project. That's ended up merging into work with wholesalers and now collaboration with researchers looking at policy mechanisms, because it does take quite a lot of time to take the long-term relational approach, and you start to see all the connections between the food system where you've got big national wholesalers who are providing food to all these independent convenience stores. And I think the solution to that for me is, how can you collaborate with others that are working at different levels to really maximize the impact of what you're doing? So where can you connect your local work with work that's happening at a regional level or national level, so that we're pushing on the same lever, but at different levels, you'll see more of a change. And that is also motivating, because this is a long-term issue that's going to take long-term action. So we need to be seeing that progress to keep ourselves moving.
Great. Milena, perhaps you have one challenge and one solution to that challenge?
One of our challenges was actually the communication. We needed to provide a very good communication between the central group until the local group, so we could have the actions happening on the ground effectively. So that was a challenge. But after we built the structure of the 3 levels that I said, and with the intersectoral approach that we had, that challenge actually succeeded. And we had a very good success in the flow of communication. And that really made the whole actions in the ground available for us.
Super. And Ravi, I can imagine some of the policy agendas that you are advancing and challenging can be met by some resistance, but perhaps you could put some words to that.
Yeah, so 3 typical barriers. One, is it going to cost consumers more money? And that's why we tend to focus more on regulation rather than taxes, because you can say that it doesn't. Secondly, is it going to be a sort of nanny state action that will force consumers to live a very different lifestyle, which is again why we think the approach of making marginal gains, small improvements across the whole basket, as opposed to big dramatic lifestyle shifts, is the feasible way of doing this. And then the third is around business, where there is a desire always for business to not necessarily be regulated, but also to make sure there's a level playing field. And sometimes it's hard to do the out-of-home sector, and therefore supermarkets, which actually make up the vast majority of the food used consumed in the UK, will sometimes say, well, we don't want to be regulated unless you can get the whole all the industries regulated. Just on one thing I'd say on the kind of local side, there's obviously a question sometimes about who has jurisdiction over what. I'm actually in Edinburgh as we speak now. We're actually having a debate about whether the Scottish government has the ability to do certain measures, or the Westminster government. It's sometimes not even clear on certain areas who has jurisdiction. but I think sometimes people have more power than they realise. They find workarounds, and that's true for local government as well. There are things you can do on advertising, on planning, also on piloting some of the changes that we are talking about in terms of the national stuff. So we're quite keen to get a kind of location-based trial where you get all the supermarkets in an area to actually trial what it looks like to create a healthy food environment.
Thanks so much. And I have some passionate comments coming in through, and some people are saying, yes, we believe exactly what Ravi is saying. Are there examples of countries or cities that have actually implemented those policies yet? So who are your sort of, in the global context, who are the front runners on some of these policies?
So I actually don't think that people are focused enough on regulation. There are examples of taxes being created. The UK have done stuff with the sugary drinks levy. Mexico has done stuff, but I think we've not done enough on the regulatory lever. And actually, if you think about climate change, I was involved in that area of policy for many years. People thought we'd get to carbon reduction largely through carbon taxes and carbon pricing. We've done a lot through just product regulation. So I think that's where there's more we can do. I think in advertising, there are examples around the world of people doing more than we have.
Super. Thank you so much. Milena, there's colleagues who are joining in saying they're excited. Some are from Brazil, and they really echo the focus on diet and physical activity, but also, the whole of community approach. They're asking, and I think that they think it's the right strategy, they're asking sort of, what is your plan for monitoring and evaluating the program moving forward? Have you started this evaluation? Are you doing baseline data collection, for example? And when do you expect to sort of be able to communicate about some results, particularly for the childhood obesity part?
Yeah, so particularly in the childhood obesity part, we already started with 12 neighborhoods, the measurement, together with an academic partner, and we're going really well. Also, we do have some challenges, but we're going really well, and we're very excited to be ending this part because afterwards, what we're going to do is implement the actions that are being co-created. That is a key word. The co-creation part is very important in our assessment in childhood obesity. And some of the ideas that are coming up are very interesting. We are thinking about getting a mobile kitchen so we can actually go to very areas that would not have the opportunity, and teach the children, give them opportunity to see what healthy nutrition is, how to have a healthy food, and also the physical activities. So we are really looking ahead for something that's going to be very special.
Thank you so much. I think we're coming to the end of our time together. If in 5 seconds, no, I'm not going to ask you that. I was just going to say, if you could summarize what success looks like in 5 to 10 years from your programs, but I think that's a bit too challenging for the short amount of time. So I guess what I'll say is we'll invite you back in a couple of years to see how we're progressing on the policy landscape, the community initiatives to address childhood health and equity. So thank you so much to the panel. I would love to have had more time with you. It was super interesting. But essentially that brings us to the end of today's talk. So thank you, Ravi, Milena, and Nikita, for your great contributions. I'm sure I will answer on your behalf. I'm sure you'll be happy to sort of answer any questions that were unanswered during this topic. And if people are curious to learn more about the work, whether that's advocating for national regulations or community-based initiatives. So thank you so much. We really appreciate it. I think today in the program, we've been able to see that creating healthier environments for children isn't just possible, it's already happening. And there's collection of stakeholders around the world who are working on this. We really believe this is the long-term solution, is to create healthier environments from the start. And we really thank you for joining today to be part of this conversation and engaging with us in such a dynamic and active way. So until next time, thank you so much. We'll be sending information about our next City Health Talk, which will take place at the end of September, on the 30th of September. So thanks for your attention today, and look forward to seeing you again next time.